Welcome back to Erie News Now Sunrise. It is March, and that means it's Colon Cancer Awareness Month.
And that's why we've got a couple of special guests in studio this morning. Dr. Matthew Clinge, along with patient Kristen Beckman, talking a little bit about colon cancer awareness. Good morning, guys.
Good morning. Thank you for getting up early with us. So we know that this is what you specialize in as a doctor. And you've gone through this journey, was it 3 years ago?
3 years, yep.
So tell us how this all came about, how you found out.
Well, my normal colonoscopy, and as I was waking up, Dr. Clinge gave me my results, and it kind of was a little bit of a shock to everybody in the family.
Sure,
So,
you thought you were just doing preventative
thought
care.
I was fine, just checking the boxes. And
Yeah. And is this something that we see very often with women?
Yeah, colon cancer is actually very common in men and women. Lifetime risk of colon cancer for anybody is about 1 in 25.
Oh, wow.
So colon cancer is very common, and that's why we're trying to get more awareness about it and about screening for it.
A lot of effort to get that awareness out in recent years. So have we seen any trends in those numbers, positively, negatively?
Yeah, there's been increased trends in screening, and as a result, there's been a decreasing trend in death from colon cancer. So, that's the goal, is to find it early. If you're going to find it, you want to find it early, where it's highly treatable. So, getting people in, the age has been changed from 50, which a lot of people, thought of colon cancer screening at age 50 was actually decreased to age 45 within the past few years because we were seeing a trend towards colon cancer in younger individuals. So colon cancer screening now starts at age 45 for the general population.
Can you talk to us about your experience with the screening itself and then with the diagnosis and treatment?
Again, the colonoscopy was very quick. Once I got my diagnosis, Dr. Clinge helped set me up with a surgeon, and I had a colon resection. Yeah. Recovering down after my surgery, they did take out some lymph nodes, which thank goodness were all negative. So I had a very good outcome.
Yeah, because you caught it.
Because I caught it.
Yeah.
Yep.
And Dr. Clinge, I think I might know the answer to this, but what are some of the main factors that prevent people potentially from coming in and getting tested as early as they should?
Yeah, I mean, I think there's a lot of hesitancy to even talk about it. People get a little embarrassed talking about their bowel movements and concerns they may have. So that's one barrier, getting people in to see their healthcare provider, number one. And then number two, people think of colonoscopies as the modality for screening, and that's one of them. There are other options, but it is something where you got to take a day off work, you got to do a bowel prep to wash out the colon to be able to see. So for some people, I think that idea is a little bit scary, but I think that vast majority of folks find that it's really much, it's not that bad. The thought about it, I think, is scarier than the procedure and the process itself.
Well, I always think if lives are at stake, it's worth having the conversation, right? Uncomfortable
Absolutely.
or not.
I say everybody poops. It's a conversation that, once you get over that barrier, it's something we all have to deal with, and that it's something that really can save lives. That's why it's so important.
You said it best. Spread the word, folks. Everybody poops.
There you go. Dr. Matthew Clinge, thank you. Chris, thank you so much for coming in and sharing your story. It is so important to get tested for that colon cancer. We certainly appreciate your presence here this morning.